Well, hello again, class. Dr. Nemecek here with week 6 of our course presentations. And we are moving rapidly along. We've only got 2 weeks actually left of classroom time, week 6 and week 7. And I'd like to remind you that in week 6, in addition to reviewing PowerPoint slides in this presentation that I've prepared for you, you need to read chapters 8 and 9. You have discussion board 6, complete assignment 6, and vocabulary quiz 6. And then next week, when we pick up week 7, we'll be closing it up with one last chapter, chapter 10, which will have just a discussion board that last week as well as a quiz. And the last day of that class actually will be not when the PowerPoint final course project is due, but you'll have 3 days according to the syllabus. You can see what those dates are. To actually go in and using Proctor Free, go ahead and submit your final course project, which is your PowerPoint presentation with voice narration. So remind yourself of where we're at, because this final 2 weeks is going to go very rapidly, and before you know it, we're going to be into the next term. And I believe that some of you probably, I don't know what actually I've got that I'm going to be teaching next term, but I may have some of you in some of my classes. I think I'm actually doing 1 or 2, also maybe at the graduate level. So anyway, week 6 has to do with value-adding service delivery and value-adding support strategies. So this is going to be 2 very similar topics. And of course, value-adding service delivery strategies has to do with the service delivery strategies are things that we are going to give to our customers that they're going to access at a point of service, either before or at a point of service or afterwards, where we're going to be evaluating the types of things that we provide to them in the way of services go. In other words, what kind of health care are they able to access within our system. And then in very similar vein, Chapter 9, value-adding support strategies are going to be things that essentially are going to support all the service delivery things that we're going to be talking about in this first section of the lecture for this chapter 8. Anyway, there are 8 learning objectives that you need to be aware of, starting off in chapter 8 of value-adding service delivery strategies. The authors want you to be able to understand the decision logic for developing implementation strategies. You need to be able to understand that the service delivery portion of the value chain is key in the implementation of any strategies that you develop. You need to be able to understand how you link the results of your internal analysis that you've done in previous weeks that we were talking about in previous chapters. When looking at analyzing your environment, you do an external and internal. Well, relative to learning objectives for developing implementation strategies, you need to learn how to link the results of that internal analysis and the development of service delivery implementation strategies, which is what we're talking about in Chapter 8. You also need to understand how the pre-service, point of service, and after-service strategies of an organization are the means to achieve directional, adaptive, market entry, and competitive strategies. Those things we talked about in last week's presentation. Learning objective number 5, understand that competitive advantage may be created inside the organization through implementation of these service delivery strategies. Be able to understand that through service delivery strategies, the organization itself may change, may have changed, or may change in the future, which will strengthen your competitive advantage and improve competitive disadvantages that you want to make sure that are eliminated and out of the way. And last but not least, the last learning objective, number 7, you need to be able to understand how to create service delivery strategies that carry out the directional, adaptive, market entry, and competitive strategies. Again, repetition of what we've talked about in our presentation last week. So relative to the strategic planning process itself, where we have gone, we have the title of the exhibit that was shown to you early on in the course, where you have strategic planning, and then the exhibit is divided up into situation analysis, where we did our external and internal analysis and developed directional strategies. And then in the next couple of weeks, we talked about strategy formulation. And we discussed this quite a bit last week in the presentation, where we talked about what directional strategies were, adaptive strategies, market entry strategies, and competitive strategies, all the things that are going to be put on paper that become part of our strategic planning process. And now that we're closing up the loop on this whole thing and bringing it full circle, we now go to what's referred to as the planning, the implementation stage, where we're going to talk about the service delivery strategies, which is what we're talking about here in this chapter, and in Chapter 9, support strategies, and after that we'll be talking about action plans that can be based on those strategies that we're going to be discussing. So again, the whole thing has come full circle from beginning to end. We did a situation analysis, determining where our organization was. We developed some strategy formulations to help us decide what directions we're going to go, how we're going to adapt, what parts of the market we're going to enter, and how we're going to be competitive with the people that we're trying to get business away from within our geographic regions. And now lastly, planning the implementation is where we're at. So if you remember a couple of chapters back, there was a strategic thinking map. And by the way, you should, as you have previously, looking at the slide presentations that are embedded in your course, you can see all of these slides that I'm speaking from. I've just pared them down to what I thought were the most important ones for each of these chapters. There's an exhibit in there called the Strategic Thinking Map, the Hierarchy of Strategic Decisions and Alternatives. And we talked about this last week again and the week before, where we moved from the directional strategies, which included the mission, vision, values, and goals that we discussed, to adaptive strategies, and the market entry strategies, and the competitive strategies. And now again, we are in the fifth column of that chart that talks about the implementation strategies. And we're at the very beginning now, where we're talking about service delivery. So we're going to be talking about what we do prior to delivering service, what we're going to do at the point of service, and what we're going to do after service. That's what services delivery is all about, is figuring out what our customers want and how we're going to provide that to them beforehand, and how well it's going to go actually at the point of when they're actually accessing the services and buying them, and then analyzing that information afterwards to see how well it went. So that's what the strategic map is going to be focusing on. So when you look back in the exhibits in your presentations, this is going to focus you on the healthcare value chain, which is kind of like a fishbone chart that has laid out for you the service delivery aspects that we're going to talk about here versus support activities. And if you go to the part of that chart where it's highlighted in red for you and talk about service delivery, it highlights for you what is meant by pre-service, what is meant by point of service, and what is meant by after service. And at the end of that chart is where we determine what value has been added by the things that we have been determined in this value chain that we're looking at. So under the topic of pre-service, we're going to be evaluating for ourselves things like conducting market research to see what we need to do to make our customers happy. We're going to be looking at target markets, in other words, making sure that we have got our products, goods, and services directed at the right market segment that we're trying to capture. And then, of course, we're going to be specifically looking at the services that we do offer, intend to offer, or intend to eliminate. And we're going to be looking at banding some of those together, what the pricing is that is relative to what people think is fair in the marketplace today, what they're willing to pay for those products, goods, or services. And then part of that process, prior to actually delivering that service in the point of service segment that we're going to talk about next, you have to have an understanding of how you're going to distribute those products, goods, and services. And from a logistics standpoint of view, you have to understand how you're going to be able to promote that information prior to it actually being presented and sold to your customers or your patients. So after you do all of that in the pre-service segment, then you're going to go to the point of service, where actually the patients are now accessing the products, goods, and services of our organization. And this is where we're going to observe clinical operations relative to the quality that we're presenting and the process innovations that we've included as part of this process. In other words, are we doing it well enough that people, when they are at the point of service, where actually accessing our healthcare organization and trying to figure out what the products, goods, and services are that they want to use for their individual purposes, we will find out and be asking ourselves at that point while we're observing it, is quality healthcare being delivered, and are we being innovative enough to capture their attention to make sure that what we offer them is something that they actually want and are going to use. And then in addition to the clinical operations themselves, we're going to be observing the marketing that we have put into place in the pre-service forward part of this process of trying to add value to our healthcare value chain. And essentially we're going to do that by looking at patient satisfaction. We'll be conducting patient satisfaction surveys as people are coming through our system, telling us what they liked, what they didn't like, whether or not our marketing was effective. And then after all of that takes place, after all of that service has been concluded, and we're at the stage now where we're actually looking to see if we added any value to this process, we're going to do follow-up things. We're looking at the clinical operations again. We're going to be looking at what we did for marketing. We're going to be looking at billing to make sure that people thought that what we were charging them was fair. And then that can be established by how well people keep up with their payments and how well insurance is paying on the things that we have been billing, whether or not our coding is proper for those purposes. And then, of course, we'll be following up not only on the clinical and marketing aspects, but on the following on, not following up, but following on with clinical marketing, meaning that if we have done things appropriately or not appropriately, following on means that we're going to make adjustments to make sure that we continue to add value in the healthcare value chain. So that's going to take us next to establishing in our own mind a logic for implementation of the strategies that we have developed. So again, we're going to be looking at an ends and a means to those ends and a means, kind of going full circle and looking at whether or not our service delivery strategies, our support strategies, and our action plans are things that we not only reduce to paper, but actually when we see them in action are going to work for the organization. So there's a slide in there that talks about, it's entitled Logic for Implementation Strategies, so you can see how that information kind of goes full circle. So essentially, what we're doing here is we are evaluating ways in which things are accomplished in the organization and occur throughout the organization, and why we should also be reviewing that information as we determine that maybe things didn't go as well as they needed to, or maybe we discover that things went extremely well and we don't want to make any changes whatsoever. And be able to do that by examining those internal processes and support activities. We're going to be asking ourselves questions about those current processes and support activities. In other words, did other parts of the organization contribute to the value-added chain, such as our Human Resources Department and our IT department, clinical support from the people who are actually delivering health care, were we actually able to align all of our strategies with all the other departments and divisions within the organization to make sure that the organization is hitting on all cylinders and running like a finely tuned engine to where at the end we can say yes, that we are adding some value to our healthcare chain and people are getting the quality healthcare that they demand from a healthcare organization these days at a fair price, and that they will be coming back for more in the future. Because after all, that's the bottom line is we want to make sure that we're doing everything right on behalf of our patients, because if we're not, they're going to take their business elsewhere. They will be voting with their feet. Another chart, an exhibit that your authors put in the PowerPoint slides for you to look at is called Developing Value-Added Strategies. And this kind of brings full circle, again, everything that we've just discussed in the previous 10 slides, where we identify the requirements of directional strategies, adaptive strategies, market entry strategies, and competitive strategies. We've also examined the results of our analysis, looking at our pre-service, point of service, and after service, the results of how that worked when we're actually delivering products, goods, and services to our patients. And all of this is going to come full circle where to be able to maintain it, we have to provide guidance for our organizational units to be able to maintain what it is that they're doing. In other words, if our people that are taking care of patients in a clinical setting where they've actually been admitted to a wing of the hospital and people taking care of them. We want to make sure that we give feedback and guidance to healthcare providers that are doing that to make sure that they can understand that what they're doing is appropriate, because we'll be hearing that back from our patients as they exit the system, and we're looking at that information and evaluating it. And this is where we're also going to give guidance to those same organizational units to expand or make changes to what it is that they're doing, for possibly add things that patients make note of in their patient satisfaction surveys that they thought would be something that we could add to the care sequence of events that would, in their minds, be value added to what it was that they were wanting to achieve relative to their own personal health care as they were admitted to our hospital or healthcare organization. It could be a clinic. So in other words, to develop value-added strategies, again, we've got to take all of these things, look at them full circle, and we are comparing these strategy requirements with the internal analysis that we've done previously to make sure that what we thought we knew was happening to the organization as part of the analysis that we did in previous stages of the strategic planning process. When we actually saw it put into action after we put it on paper and try to make it work, when we start comparing all that information, that it actually worked the way that we thought it was going to. And the reason, of course, that we do that is because if things are not working well, then that gives us the opportunity to make changes to our strategic plan and take a modified approach to whatever it is that we've identified as not working well. So in conclusion, again, make sure that you take a look at the end of Chapter 8 like you do in the other chapters. There are some excellent questions for class discussion that are found on page 341. There are 9 questions there that if you can look at those and pretty much answer what the answer to that question is by virtue of going through this chapter and reading about it, you'll have picked up on some of the key terms that they talked about, such as after-service strategy, the difference between follow-on and follow-up, marketing research, things like that. You'll see all of those terms that are listed for you again at the end of Chapter 8. So anyway, that concludes what Chapter 8 is all about. So let's take a look now at Chapter 9. And again, Chapter 9 is very similar, and instead of being value added for service delivery strategies, Chapter 9 is value adding support strategies. So essentially what you can do relative to the objectives in this, the 7 that they've identified for this chapter, is all you have to do is, what's the word I'm looking for? Substitute the word support and, from the previous chapter, you want to substitute the word service delivery and put in support strategies, and all of the learning objectives for Chapter 9 will be the same as they were for Chapter 8. They want you to have an understanding how value-adding support strategies are important elements of the implementation of strategy. Same thing with number 2. Appreciate the importance of aligning value-adding support strategies as opposed to service delivery, which is what we're talking about in Chapter 8. So as you go through these learning objectives, you note that all 7 of them are going, there's 7 of them altogether, are going to be just like the ones that are in Chapter 8. You just substitute one word for the other. Now again, looking at the slides that were provided to you in previous weeks, the strategic planning process of events that they've laid out for you in the exhibits. We're now in the planning implementation stage, which is all the way at the bottom of this particular exhibit. And instead of looking at service delivery strategies, we're now looking at support strategies. And again, taking that information one step further through the strategic thinking map, we're going all the way over to the 5th column on that exhibit, to the middle of that column where it says support. We're going to be looking at the culture, structure, and strategic resources that we need as part of developing implementation strategies and that are going to give us value-added support strategies that are going to support what we did for our service delivery stuff in Chapter 8. So take a look at that strategic thinking map. And I believe that it's in Chapter 9, it might have been in Chapter 8, where they had a really big example of a strategic map laid out for you. I guess that was in Chapter 8, where they show you exactly in a strategic thinking map how all of these things are laid out for you so you can make some sense out of them. And then also in the slides, I'll look at the healthcare value chain again, which is kind of a bone chart like we were looking before, a modified arrow where at the bottom of the chart now we're looking at support activities, trying to determine what the value added is in our healthcare value chain, and the things that we need to do to figure out what our support activities should be. And these are going to be things that help to support service delivery. So we're going to be looking again at our organizational culture, our structure, and strategic resources that we need to be able to do that. So under the organizational culture, we're going to be looking at shared assumptions, things that we believe as an organization is part of our culture. We're going to be looking at our shared values and trying to make sure that we're all singing off the same sheet of music there. And we'll compare that to our behavioral norms and what we see actually taking place in our organizational culture on a day in and day out basis, and whether or not that culture is adding any value to the healthcare chain that we are looking at trying to evaluate. And again, after we do that and look at the culture, we're going to actually look at the structure that we're functioning under, and this is where it's beneficial to look at your organizational chart so we can look at each of our elements in that chart to look at who's in charge of particular divisions and break it down to departments and what their individual functions are. And that organizational structure essentially is a matrix of who does what to whom within your organization, and whether or not that current organizational structure actually is providing any added value also to your healthcare organization. So that again is in support of, in conjunction with organizational culture, the things we looked at, the shared assumptions, shared values, and behavioral norms, and again with the guise of supporting service delivery, the things that patients are actually purchasing from us at a point of service, the service delivery of products, goods, and services that patients are buying from us, and essentially what they're doing is accessing healthcare. And last but not least, we need to determine strategic resources that are going to be helpful, that we either have or don't have, or things that we may want to add to our organization. We're going to look at our finances to see whether or not we have the financial resources and capability to provide, from a value-added standpoint of view, what the organization wants to do now and into the future. And also, those strategic resources are going to include important elements of our organization like human resources, information, and technology, and all the other important divisions that have an important part to play in the organization structure that we're looking at. So again, we are looking at support activities. These are things that support the organization in helping us to deliver added value to our healthcare organization. So again, that chart is going to break down the organizational culture, it's going to break down the organizational structure, and it's going to break down the strategic resources, and all those things will be listed for you and shown directly and talked about in Chapter 9. So, again, this is one of those chapters that's got a lot of information in it, but I don't expect you to commit a lot of it to memory. Just get familiar with the terms, and then when you take a look at the questions at the end of the chapter, again, key questions, if you're able to look at those and have a good understanding of not only the key terms that they introduce to you in that question, but you have an inkling or an idea of where to go to find that in that chapter and understand how to answer that question, then your reading of this information will have been successful. So again, like in previous chapters, last week where we talked about chapters 6 and 7, these chapters have a lot of really good information in them. But again, a lot of it is good support information and stuff that you don't necessarily have to commit to memory. But it's just kind of a good introduction to things that you need to be aware of as a manager in a healthcare organization. And especially if you want to become a senior level manager, this is the kind of information that you've got to have a good idea what it means, and be familiar with the terms when people are talking about stuff like this in meetings, because this is the kind of stuff that people are going to be asking you for your advice about and what your opinion is about how to do things like this. So again, I don't expect you to commit this to memory, but I would like you to become familiar with it so you know where to find it later in the text. So that is our Week 6 presentation, and If you have any questions, again, you can contact me via email directly, or if you need something more urgent, give me a telephone call. More importantly, don't forget that we are winding down. This will be the last 2 weeks of the course, and actually, when week at the end of this week, there really is no week 8. Is when you're going to be required in one of the 3 days. That'll be Proctor Free is going to be open. You'll be able to just go ahead and submit your PowerPoint presentation at that time. And remember, the difference between Proctor Free and the other proctoring service that we used is that you don't have to sign up for this one. It's always going to be available on demand 24/7 for those 3 days that they've got it open. I'm not sure why we had, why we have to identify 3 days, and that mostly takes us like into the following week. That stuff that's determined by the university, but that's how they do it, so we're stuck with how that stuff is set up for us. So in any event, thanks for your attention, and if I don't hear from you, have a good week, and I'll see you in week 7 with our Chapter 10 presentation and closing up the class with communicating the strategy and developing action plans. So have a good week.